Dr. Lori Mosca is the Director of Preventive Cardiology at New York Presbyterian Hospital and also the author of Heart to Heart. Hi, Dr. Mosca.
Hi.
Good morning.
Good morning.
Well, there's some things you can't really mess with in terms of your risk factors. Family history, age, race, and diabetes, right?
That's right.
You can't change any. Well, could you change diabetes, for example?
Well, there are things that you can change, as you pointed out, but we focus on the things we can change in preventive cardiology. But it's still important to know whether you do have diabetes or family history, as you pointed out, because we want to be more motivated to control those things we can if we are at risk.
I know that the things that we can change are things like lifestyle. So obviously what we eat and how we exercise, correct?
That's right. In fact, the American Heart Association really emphasizes lifestyle as a means to prevent heart disease because it's really the root cause. So we want to avoid smoking, we want to get regular physical activity.
And what is the ideal amount of
weight.
regular exercise? Because it's all over the map.
You know, even 30 minutes a day, Katie, of moderate activity, just brisk walking can lower your risk for a heart attack.
7 days a week?
That's right. We like to emphasize it as many days a week as possible.
Also, let's talk about blood pressure. I know you say test it often, but how often is often?
Well, that's a good question. I think that whenever we go to the doctor, we want to make sure we get our blood pressure tested. But more importantly, Katie, what we need to do is make sure we ask the doctor, what is our number? We need to know our numbers.
And you say you should be a number of or less than 120 over 80.
That's right. Ideally, we like to see the blood pressure less than 120 over 80.
I have sometimes 110 over 60.
That's okay.
And the doctor's surprised I'm actually alive. Okay, let's go to cholesterol. There's good and bad cholesterol, and I'm always so confused about this, Dr. Mosca. Good cholesterol should be 50 for women or more than 40 for men, right?
That's right. That's the HDL, the good cholesterol. We want it higher than those numbers, and then we have LDL, the bad cholesterol, and we want that one less than 100.
Really? Less than 100?
And you know, actually, Katie, in patients that already have heart disease, we even shoot even lower, less than 70 in many cases.
Now, it's interesting because waist circumference is another sort of indicator, which goes along with the old sort of idea that apple figures are more at risk for heart disease than pear-shaped women, for example, right?
That's right. The new thinking is it's not if you're fat, it's where you're fat. And it turns out that belly fat is what's really important because we know that certain risk factors like high blood pressure, high cholesterol, low good cholesterol, and diabetes are all related to having an increased waist size and belly fat.
So you should have your woman, or you should have less than 35-inch waist.
Right.
And if you're a man, you should have a less than 40-inch waist.
That's right. And you know, one of the good things about this is people can do this at home. Just take a simple, tape measure, and if you happen to have, a circumference higher than those numbers, there's a good chance that you have those other risk factors.
Okay, we also created an animation, Dr. Mosca, to show what heart disease is and what happens when a heart attack takes place. Can you just take us through this? Obviously, there's a beating heart.
Right, certainly. Well, we used to think, Katie, that heart disease was simply a buildup of plaque, but now we know that even though plaque's laid down over many, many years, even as early as the teens it can start, that what happens when we finally have a heart attack is as that plaque builds up, it can rupture. And when it ruptures, it attracts inflammatory particles and clots to that crack. And then there's a clot that develops that blocks the blood flow, and then the muscle dies. So it's really a two-pronged effect.
So it's a piece of plaque that comes undone or unglued, if you will.
Yeah, kind of like a little crack in the plaque.
Interesting.
And then the clot thickens.
And the clot thickens, and you can reverse heart disease in your view.
Well,
we have all week to talk about it because we're out of time. Dr. Mosca, thanks so much.
Thank you.
And we'll be back after your local news.